Everybody, welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jagos. Today is the last part of the part 6 of the treatment of one-sided disease of the external kind, that is the mental disease. So in this video, whatever is given in the 6th edition of Organon, I'll be telling you, as compared to the previous video, which was a bit off track, but nevertheless important. So the mental diseases, it is given in episode number 210 to 230 in the 6th edition of Organon, and it belongs to the one-sided disease, and they are soric in origin. They are more difficult to cure due to its one-sidedness, and they include symptoms both on the mental and physical plane. So the definition of mental disease is that they belong to the one-sided disease, they are soric in origin, difficult to cure, and include the symptoms on the mental and the physical plane. So these 4 points are quite important in order to have a complete definition of what do you mean by the word mental disease. So let us see something about the introduction of mental disease. While selecting the similimum, we must always consider the altered state of the disease. So Dr. Hahnemann has said that while treating a mental disease, you must always select the similimum and you must give the importance to the altered state of the disease. The symptoms belonging to the disposition. Now, what is the altered state? That means, Dr. Hahnemann said, you have to try to identify the disposition, is particularly to be noted along with the totality of the symptoms. So disposition, nothing but the type, typology, or the constitution of the individual. So by going into the depth of the case, you can be a position to judge what is the disposition of the patient. The symptoms will include the character symptoms, which many a times are concealed from the accurately observing physician. So you have to, in order to identify the disposition, you have to find out the characteristic symptoms, which Dr. Hahnemann says that many a times you cannot identify the symptoms which are characteristic because they are concealed. Thus, the change of the state of mind and disposition is to be taken into consideration. So Dr. Hahnemann again reminds us that you have to take into consideration the altered state of the disease. That is what, in short, the changes of the mind and the disposition to be taken into consideration. Now, as I told you, I will be explaining to you disposition in this video into more detail as compared with the previous video, which I have just told you something about disposition. So the important footnote number 122 with respect to episode number 213 with respect to disposition is as follows. So he gives it, Dr. Hahnemann tells you that you have to identify the disposition. That means what? He's giving an example that aconite is not suited to a calm and quiet disposition. So suppose the patient is calm and quiet, you cannot give aconite. Vomica is not suited to a mild and phlegmatic disposition. Pulsatilla, where happy and gay. Ignatia, when it is not supposed to be frightened or vexed. So according to the disposition of the patient, the remedy has to be given. Different remedies have different disposition. So accordingly, the characteristic evolutionary march of events have to be taken into consideration along with the characteristic symptoms. Then only you'll be able to identify the disposition and identify the homeopathic similimum. Therefore, the so-called mental and emotional diseases are nothing more than the corporeal disease. That is what? They cannot be separated as mind and body as they are a unit of life. So in mental disease, it'll incorporate both symptoms at the disposition as well as symptoms at the physical level. The symptoms belonging to the derangement of the mind and disposition are increased while the corporeal symptoms decline. So he says that also that when the symptoms of the mind and disposition increase, the corporal or the physical symptoms decline. Thus, the disease attains a one-sidedness as it were a local disease in the individual subtle organ of the mind and disposition. So therefore, he says that the disease will go into a one-sidedness as if it was a local disease with a few symptoms on the level of the mind. So now let us see the different types of mental diseases which Dr. Hahnemann describes in the 6th edition of Organon. So there are totally 4 types. The first type, given episode number 216, somato-psychic disorder. So soma means body, psychic means the mind. So a corporal disease that threatens to be fatal, like suppuration of the lung or deterioration of some other important organ or some other disease of an acute character. Corporal disease meaning a physical disease. So therefore, what Hahnemann says that this first type of mental disease is because of some physical disease which the patient is suffering, and it threatens the life, or it may be fatal. Like, for example, is given a suppuration of a lung or the malfunctioning or deterioration of some important body in the of some important organ in the body. It becomes transformed into insanity, a kind of melancholia or mania. So what it says, because of this corporal disease which was threatening life and which may be fatal, the person becomes very sad, very depressed, or he may go into a sort of an insanity or mania. So out here you're seeing that the patient has a physical disease. Once he comes to know the severity of the physical disease, for example, it is incurable, and in a short period of time, the patient will die. So what happens? The patient then forgets about his physical disease, and directly it is transformed at the level of the mind into melancholy, sadness, depression, mania, or insanity. Thus, the disease travels from the body to the mind. So it goes in a one-sidedness from a body. So whatever symptoms were there because of the malfunctioning of a certain organ, the patient has totally forgotten about it, and it goes into a one-sidedness on the mental level in which the patient experiences insanity, mania, or depression. The corporeal symptoms improve or they get reduced to such extent that only a well-trained homeopathic physician will be able to identify the phenomenon. So what Hahnemann says that if the homeopathic physician is only well-trained, then only he'll be able to identify that this mental disease, or for example, depression, is because or was because of the corporal disease. If he doesn't observe this, then he'll go on the wrong track. Thus, the disease gets transformed into a one-sided manner on the mental plane. It replaces the physical symptoms of the patient. So whatever physical symptoms of the patient are there, it has been replaced by symptoms at the level of the mind. In the treatment of such a condition, we must able to perceive the evolutionary march of events. So you have to trace the condition of the patient before the depression sets in. The symptoms pertaining to the physical body before it got deranged onto the mental level should be taken into consideration. So what symptoms should you take? You must take those symptoms which were there, which were pertaining to the physical body. This can be obtained by the patient's friend. So whoever accompanies the patient, his mother, father, brother, sister, friend, relative, whoever is there, they will be able to tell you about the symptoms pertaining to the physical body of the patient before it got deranged to the level of the mind. So this is only possible if the physician will be able to identify this phenomenon. So this is very important. A suitable remedy covering both the mental and physical symptoms according to the total symptoms must be discovered. So Dr. Hahnemann says that you have to take the totality. Mental and physical are not separable. Both are interdependent upon each other, mind on the body, body on the mind. Therefore, we have to take the symptoms which cover both the mental symptoms and the physical symptoms. So in short, you take the characteristic totality and then discover the medicine. Now, the second type is acute mental disease or mental disease due to sudden outbursts of latent sora. So Dr. Hahnemann says that this is an acute mental disease. As you all know, the acute diseases are because of sudden trigger of the latent sora or outburst of the latent sora. So you get sudden insanity or mania caused by fright, vexation, or abuse of spiritual liquors. And it is due to sudden outbursts of the internal sora. So why does the acute mental disease occur? It occurs because of the sudden outburst of the latent sora. The treatment with acute remedies followed by antisoric. So Dr. Hahnemann says that the acute phase you must treat with acute remedies and always follow it up by an antisoric. If you do not follow it up by antisoric, again there will be an relapse. So this is very important. After the acute phase has subsided, always go in for an antisoric medicine. Acute remedies. So Dr. Hahnemann said that in the acute phase, you can use the remedies like acute remedies like Aconite, belladonna, stramonium, hyoscyamus, mercury, etc. in highly potentized dosage should be given. So as you all know, in these remedies, you are getting acute states which are very useful to treat such patients. This will subside the sora which is activated and will get back the patient into the normal state. So if we use these acute remedies like belladonna, stramonium, etc., what will happen? The sora which was activated again would come down, or it will be subdued, and the patient will come back to the normal state. But when the patient comes back to normal state, Dr. Hahnemann always advises us to give an antisoric remedy immediately, or else again the disease will be activated. So once the acute state subsides, the patient has come into a state of normalcy, immediately followed up by an antisoric medicine. If you do not give the antisoric remedy, then the disease may become periodic or continued and will become more difficult to treat. So he said, if you do not give the antisoric medicine after the acute phase has subsided, then it's quite possible that the disease will again reoccur on a periodic manner, or it will be a continued affair and it will again become difficult for you to treat. Third type. So out here, basically followed by an antisoric, he always is telling us that always give sulfur after the acute phase has subsided, because as you all know, sulfur is the king of antisoric. So if you do not give sulfur, Dr. Hahnemann says that again the acute disease will become more periodic or more continued and it will be difficult to treat. Third type is the mental disease of doubtful origin, in which you get either it arose from a corporeal affection, or whether it was the result of faulty education, bad practice, corrupt morals, neglect of mind, superstition, or ignorance. So out here there are two types. Number one, faulty education, or because of corporeal affection. So the treatment would be to give sensible, friendly advice in case of mental disturbances arising from faulty education, bad practices, etc. So if the mental disease arose from faulty education, bad practices, corrupt morals, neglect of the mind, superstition or ignorance, you have to give sensible advice and sensible, or rather treat the patient in a more friendly manner. In short, you must give psychotherapy and counseling. If, however, the mental disease arose from a corporeal affection, then such advice would aggravate the patient. But however, if the mental disease arose from a corporeal affection, and if we would give sensible advice, etc., then this would just aggravate the patient. He says the melancholy would become more dejected, quarrelsome, inconsolable, and reserved. The spiteful mania would become more aggravated, and the chattering fool would become more foolish. So these are the examples what he has given you. The fourth type, the last type, 225 to 226 aphorism, the somatopsychic disorders. So it is caused due to the body being exposed by emotional cause of content, anxiety, worry, vexation, fear, and fright. So as you all know, in today's 21st century, the psychosomatic disorders form a big chunk of the diseases in medicine, and it is caused by emotional causes like hurry, worry, curry, long anxiety, or long exposure, prolonged exposure to worry, grief, etc. This kind of emotional disease in time would destroy the physical health of the patient to a great degree. So if you're constantly under worry, under stress, under strain, naturally it will become evident later on the physical body. So this emotional disease in time will progress, would destroy the physical health of the patient to a great degree, or to progress from the mental level over to the physical level. That is the psychic level to the soma, that is the body, therefore psychosomatic. Treatment would be, number one, you have to definitely identify the phenomena. That's very important. If you don't identify, you will not know what type of mental disease you are treating with. Act fast before the disease has affected the physical body. Now, this is what he has to say, but it is difficult because most of the time when the patients come to us, the physical body has already been affected. Therefore, by giving psychotherapy and advice how to manage lifestyle-related disorders. So, besides giving the medicine, you have to basically give only psychotherapy, and you have to modify the patient's lifestyle if it is incorrect. So therefore, just by giving psychotherapy and modifying the patient's lifestyle, you could avert the disease being on the physical body. So you can give friendly advice, display confidence that he will be well, all will be well, and include some good changes in diet and regimen of the patient, which will help to regain a good state of health. So your advice is very important, and you have to give it with friendliness, display confidence, and do not be rude to the patient, and just modify some modified diet and regimen so that good health will be regained. Always remember that the fundamental cause is the psoriatic miasm. Hence, before I can develop into full-blown disease, give the antipsoriatic remedy. This will prevent the disease to recur again. So again, Hahnemann is always telling us that after the acute phase has been subsided, always follow it up by the antipsoriatic medicine, because he said that the mental diseases are mostly because of the majority of the mental diseases are because of the sudden outburst of the latent sorrow. So if you follow it by antipsoriatic, then the recurrence would be prevented. Thus, to conclude, mental and emotional diseases resulting from physical disease can only be cured by the homeopathic antipsoriatic medicine. Along with this, the diet and regimen of the patient has to be taken into consideration and according sound advice to be given, which I have just told you. Even the N1 factor should be modified if necessary. Thus, the homeopathic physician should behave with dignity, grace, and decorum in the face of crisis of the patient's life. So this is very important. Dr. Hahnemann has told us that always be friendly with the patient, give sensible advice, do not be rude with the patient, do not punish the patient for his involuntary hideous acts, but just give some good advice and be calm and treat the patient with a calm and cool mind. So that's all for this video. So all the 6 parts have been taken up of one-sided disease. Hope you found it useful. For those who are new, please do subscribe to my channel. And if you like the video, please do give it a thumbs up. And please do pass on the word to other students of different colleges so that they also benefit. Hope you enjoyed this video. Thank you so much.